Lupus, systemic lupus erythematosus, SLE. What is SLE? Lupus or systemic lupus erythematosus, SLE, is a disease of the immune system. This causes one's own immune system to attack any and all otherwise perfectly healthy parts of the body. Lupus is called an autoimmune disease because the immune system is targeting its own healthy body. Symptoms. Symptoms can be triggered by stress, sun exposure, and certain medications. Some of the symptoms include chest pain, fever, swelling or inflammation, sun sensitivity, dry mouth, dry eyes, the red butterfly rash across the face, joint and muscle pain, mouth ulcers, hair loss, fatigue, anemia, and kidney problems. How is it diagnosed? Clinical symptoms and indicators are typically used for identifying lupus, and then the doctor will order laboratory tests to confirm the diagnosis. Early diagnosis is important in order to be able to quickly manage your symptoms. Although acquiring a diagnosis is the hardest part, doctors will often test for lupus as a last resort. An ANA anti-nuclear antibody blood test is very common when diagnosing SLE. Though this test isn't a foolproof method, as many who test positive may not have lupus, and many who test negative will indeed have lupus. Who's at risk? Lupus is more common in women than in men. They are 9 out of 10 times more likely to have lupus than a man. Most people are diagnosed and experience lupus symptoms between the ages of 20 and 30. And most commonly, lupus is seen in women who are of African descent, Asian descent, or Hispanic descent. Caucasian women are least likely to contract it. The likelihood of having lupus is higher in relatives of those who already have it. Children whose mothers have lupus will contract the disease in only roughly 2% of cases, though. Treatment. Medications that prevent malaria are frequently used to lessen fatigue, skin rashes, and joint discomfort. When it comes to treating severe lupus symptoms that impact the heart, lungs, and nervous system, steroids like prednisolone are the preferred treatment since they are highly effective anti-inflammatory agents. Immune suppressive medications like methotrexate work by suppressing the immune system. They are typically used when the disease is increasingly prevalent and steroids are insufficient when managing it alone. Someone with lupus might also see a rheumatologist or an immunologist to manage their disease. Blood tests. Some of the blood tests that a person with lupus may be required to get regularly are an APTT, activated partial thromboplastin time, which is 1 sodium citrate tube. An ANA, anti-nuclear antibodies, is 1 SST tube. ESR, an erythrocyte sedimentation rate, 1 EDTA or ESR tube. Liver function test, LFT, 1 SST tube. CRP, C-reactive protein, 1 SST tube. Or a CBC, complete blood count, which is 1 EDTA tube. CRP and ESR are to detect for any inflammation. CBC can help to see if the patient is low in red blood cells, white blood cells, or even platelets. ANA tests can reveal any antibodies which are against the body's tissues or cells. The main purpose of the APTT is to identify abnormalities in the coagulation pathway by measuring the time it takes for a blood sample to clot. And the LFT test is to make sure that none of the medications are causing any liver issues. Additional testing would be X-rays and electrocardiograms to check the condition and function of the patient's heart, urine tests to check if there's any blood or proteins inside the urine which could indicate kidney involvement, which would be a 1 times 70 ml urine specimen container, and biopsies of the kidneys to detect if the kidneys have taken any damage. Medical terminology. Autoimmune, auto meaning self in Greek, immune from the Latin word immunus, meaning exempt from disease. Therefore, autoimmune describes the malfunction of the immune system causing it to attack itself. Erythematosus, the Greek word eryth, meaning red, and osis being a suffix meaning characterized by. Erythematosus equals characterized by redness. Systemic, the root word being system, is in reference to a body system, and the suffix being ic, as in relating to, this meaning the whole body is affected and not just one part. Rheumatologist, rheuma, is the prefix or root word meaning flow, and ologist being the suffix meaning one who specializes in it. Immunologist, immune, prefix being immune system, and ologist, suffix being one who specializes in. And my references.